Yeah, I'm Dr. Jubin Jacob. I'm from Ludhiana, and at the SECon here I'm talking about the options that we have for fertility preservation in patients who are undergoing treatment for cancer. So what I think now, with younger patients getting cancer and with more better cure rates, we have a lot of cancer survivors, and these cancer survivors unfortunately may not regain their fertility back, primarily because of the toxic treatment that we employ when we treat these patients for cancers, including both chemotherapy and radiation. So it's become now part of standard of care to discuss options of fertility preservations with patients with cancer prior to treating them with cytotoxic or gonadotoxic treatments. So my main focus of the talk, as most of us are endocrinologists, is how we can manipulate the hormones to try and avoid the gonadotoxicity. Primarily, I think the best method is still cryopreservation. For a man, it is cryopreservation of the semen, and for women, it's cryopreservation either of the embryo or of an oocyte which has been harvested. But these are not; these are usually managed by reproductive medicine specialists. So what endocrinologists can offer is hormonal manipulation, and primarily by shutting down the hypothalamic pituitary gonadal axis by the use of GnRH analogs. And this method is reasonably effective in women who are planning to undergo cancer chemotherapy, but not very effective in men. So for men, I think cryopreservation is still the primary treatment of choice. Hormonal manipulations will not have much of a role. But women who cannot cryopreserve either embryos because of many reasons, or cannot get an oocyte for cryopreservation, I think the option of GnRH analogs to try and prevent cytotoxicity onto their gonads is, I think, what I will be focusing on. And the mechanisms by which these work are not very clear, but primarily it's because by reducing FSH drive on the gonads, and also probably by reducing blood supply to the gonads and reducing the access of chemotherapeutic agents to the gonads itself. So I think that is a gist of what I'll be talking about. Thank you.